Hello guys, welcome to my YouTube channel. In this video, you will learn the anatomy of humerus. In humans, the humerus is the bone that is present on both arms. It is the longest bone of upper limb. This is the right humerus and this is the left humerus. Next, how the humerus articulates. The answer of this question is that proximally it articulates with the glenoid cavity of scapula and distally it articulates with trochlear notch of ulna and head of the radius. The humerus is divided into three main features: the upper end, which is called proximal extremity, the lower end, which is called distal extremity, and the body or shaft that connect the upper and lower end of humerus. This is anatomical position of humerus. This is the head of humerus that form joint with glenoid cavity of scapula. Thus, the humerus and glenoid cavity together form glenohumeral joint. There are two roughened elevations on the proximal surface of humerus. One is large, which is called greater tubercle, and one is small, which is called lesser tubercle. There is a groove that is present between the greater tubercle and lesser tubercle, which is called intertubercular groove. This is the anatomical neck of humerus that surround the articular surface of head of the humerus. This is surgical neck that present immediately below the greater tubercle and lesser tubercle. The prominent or raised part of the bone is called crust. In humerus, there are two crusts. One is crust of lesser tubercle and second is crust of greater tubercles. These crusts basically play important role in attachment of muscles to bones. The body of humerus consists of roughened elevation that is present on anterior lateral surface of humerus, which is called deltoid tuberosity. The posterior of deltoid tuberosity there is a groove for radial nerve called radial groove. The body or shaft of humerus consists of two surfaces. One is anterolateral surface that covers the anterior and lateral borders of humerus. The other one is anteromedial surface which covers the anterior and medial borders of humerus. The distal end of humerus consists of two projections. One is small and one is large. The smaller one is called lateral epicondyle that covers the lateral surface of humerus, and the larger one is called medial epicondyle that covers the medial distal surface of humerus. There are two ridges on the distal surface of humerus. One is lateral supracondylar ridge that running proximally from the lateral epicondyle, and other one is medial supracondylar ridge that running proximally from the medial epicondyle. Capitulum is the rounded half spherical articular surface that form joint with the head of radius, and there is a pulley shaped articular surface which is called the trochlea that form joint with trochlear notch of ulna. The distal end of humerus also consists of three fossas. Two are visible on the anterior distal surface of humerus. One is CORONOID FOSSA and second is RADIAL fossa. The third is olecranon fossa that is present on the distal posterior surface of humerus proximal to the trochlea. name from humer, which means shoulder in Latin. It is located on both arms and it is the longest bone of upper limbs. It helps in articulation of shoulder joint and elbow joint. It articulates proximally with the glenoid cavity of scapula and distally with the trochlear notch of ulna and head of radius. As described earlier, the humerus is divided into three main parts or features. The upper end of humerus called proximal extremity, the lower end is called distal extremity, and the body or shaft that is present on the medial of the humerus and connect the upper and lower ends of humerus. The proximal extremity of humerus consists of a head, two roughened elevations, greater tubercle and lesser tubercle, and two constricted regions. One is anatomical neck and other is surgical neck, and having a groove called intertubercular groove. The head of humerus, which is also called the caput humeri, is a round, smooth proximal end of humerus that oriented medially, superiorly, and slightly posteriorly. It articulates with the glenoid cavity of scapula, which is basically present on the upper or lateral border of scapula. Thus, the head of the humerus forms glenohumeral joint at the pectoral girdle. Next is greater tubercle, which is called tuberculum majus, is a large roughened elevation on the lateral proximal end of humerus and proximal to the head of the humerus. The lesser tubercle, which is a small roughened elevation, so is also called the tuberculum minus, that is present on the medial proximal surface of humerus and is immediately inferior to the head of humerus. Next is anatomical neck, which is also called collum anatomicum, is a slight constriction that surrounds the articular surface of head of the humerus. The articular capsule of glenohumeral joint attach the inferior edge of anatomical neck. By the way, the fracture in this region is rare but more frequently occur in elder age. Another constricted region is the surgical neck, which is also called collum chirurgicum, present immediately inferior to greater and lesser tubercle. It forms interface between the proximal extremity and the body or shaft of humerus. It has important relations with axillary nerve and posterior and anterior circumflex humeral vessels. Fracture in this region is most common. Intertubercular groove is a groove that is present on the anterior surface between the greater tubercle and lesser tubercle. Thus, this groove separates both tubercles. It extends into upper third of shaft of humerus and houses the tendons of bicep brachii muscles. Next, the shaft or body of humerus, which consists of deltoid tuberosity, radial groove, and anterolateral surface and anteromedial surface. The deltoid tuberosity, which is also called tuberositas deltoida, is a small roughened elevation that is present on anterolateral surface of midshaft of humerus. It provides site for attachment of deltoid muscles. Immediately posterior of deltoid tuberosity, there is a groove for radial nerve called radial groove. This is actually a shallow depression that surrounds the lateral and posterior aspect of midshaft of humerus. The groove is more prominent where is lies between deltoid tuberosity and upper end of lateral supracondylar ridge. Fracture of midshaft of humerus is most common, occur in the inferior of deltoid tuberosity, thus affect the radial groove and its contents. The anterolateral surface, which is also called the facies anterolaterales corporis humeri, is the area limited between the anterior and lateral borders of humerus. Most part of this surface covered with deltoid muscles. The anteromedial surface, which is also called facies anteromedialis corporis humeri, is the area limited between the anterior and medial borders of humerus. Most part of this surface covered with brachii muscles. The distal or lower end of humerus consists of lateral epicondyle, medial epicondyle, trochlea, capitulum, radial fossa, coronoid fossa, and olecranon fossa. The lateral epicondyle, which is also called epicondylus lateralis humeri, is a small projection present on the lateral distal surface of humerus. The common extensor tendons are attached here. The information of these tendons is called lateral epicondylitis. There is a ridge on a lateral distal surface of humerus called lateral supracondylar ridge that running proximally from the lateral epicondyle and form the lower lateral border of humerus. The medial epicondyle, which is also called epicondylus medialis humeri, is a knob-like projection that is present on the medial distal surface of humerus proximal to the trochlea. The ulnar nerve crosses the posterior of medial epicondyle into the shallow ulnar sulcus. When the nerve comes in contact with the epicondyle, it is stimulated and produces a tingling sensation in the medial border of hand and fifth digit. Because of this characteristic, the humerus is also called the name of funny bone. At the distal lateral end of humerus, there is half spherical rounded shaped structure which is called capitulum, which form joint with the head of the radius. Thus, the radius and humerus form humero-radial joint with the help of capitulum. There is a distal pulley shaped articular process at the distal medial end of humerus which is called trochlea. The trochlea form joint with the trochlear notch of ulna. Thus, the trochlea and the trochlear notch of ulna together form humero-ulnar joint. Thus, the trochlea and capitulum together cause the hinge movement of elbow joint. The distal anterior surface of humerus consists of a fossa that is proximal to the trochlea is called coronoid fossa. The coronoid fossa, which is also called the fossa coronoidea humeri, receive the coronoid process of ulna when the elbow is fully flexed. There is another fossa on the distal anterior surface of humerus called radial fossa. The radial fossa, which is also called fossa radialis humeri, is a depression that is proximal to the capitulum, receive the margin of head of radius when the elbow is fully flexed. The third one is olecranon fossa that is present on the distal posterior end of humerus and proximal to the trochlea. The olecranon fossa, which is also called The fossa olecrani is a depression that receives the olecranon process of ulna when the elbow is fully extended. Thanks for watching. Don't forget to subscribe, share and like my channel.